I'm Dr. Joe DeMarco, chiropractor and owner of OcraMed Health, and today we're going to talk about how to perform some fascial release work on the subscapularis muscle. Now, what's the subscapularis? Well, that's one of our 4 rotator cuff muscles. It's probably the strongest of the 4, and its primary function is to internally rotate the shoulder. Now, of course, working with the other 3 rotator cuff muscles, the main purpose of that group of muscles is to stabilize that shoulder joint. Without stability, we can't have shoulder strength. There's no strength without stability. If that shoulder joint isn't being stabilized by those rotator cuff muscles, and I've said this before, you could have watermelon-sized deltoids, you're just not going to have any shoulder strength. So it's so important to keep these rotator cuff muscles flexible, strong, and healthy. Okay, so, the subscapularis, as far as doing some fascial release work on it, if you're trying to find information, it's one of those muscles that are kind of ignored. And the reason being is just because of the anatomy, which we're going to talk about in a second. But it's not the easiest muscle to get to. But I'm going to show you an awesome technique of how you can do some fascial release work on it at home. Okay, so how do you know if you have an injury to the subscapularis? And of course, if you have an injury to your subscapularis or anything of the body or any rotator cuff muscle of the body, make sure you see your doctor or therapist. There's my disclaimer. Okay, so the subscapularis. If you can do what's called a lift-off test, you can put the arm, the back of the hand against the back, put it behind you, and then pull the hand away from the back. Pain on this motion is a good indication that that subscapularis might be inflamed or irritated. Or you may not have any pain on that, but when you do the right side, you can pull it away 6 inches, and when you do the left side, you can only pull it away from the back 4 inches. You probably have some fascial adhesions on the left subscapularis, and that's what you'll want to work on, okay? So, why does that subscapularis muscle build up adhesions? I can give you a couple scenarios. One, if we're talking about the sedentary individual out there who does a lot of work at a desk, at a computer. When you're sitting at your desk, sitting at your computer, and you're in this position, what is this position? My shoulders are internally rotated, and if I'm leaving them there like that all day in kind of a hunched forward position, internally rotated, working on my computer, writing on my desk, and you leave that subscapularis in that position, it's going to build up adhesions, and it's going to create more and more internal rotation of the shoulder. Gym-wise, working out, subscapularis muscle, it gets tight. What do people work the most when they go into the gym? Unfortunately, it's always about chest and shoulders, and of course you see it all the time. People start lifting weights, and for some reason those shoulders just start getting internally rotated, and you see these people walking around like this. You can build big muscles and still have mobility and flexibility, but a lot of people allow those internal rotators, which include the subscapularis, to get tight. So whatever the scenario is, we want to keep that subscapularis muscle on each side. We want to keep it loose. Matter of fact, I did a previous video. I'm going to put the card up right now, and it talks about how sometimes the tightness in the subscapularis and other internal rotators of the shoulder can lead to bicep tendonitis. So check out that video too. It's some good information. Okay, let's go back to the anatomy. Why is this subscapularis muscle not a popular area to work when it comes to fascial release work? And like I said, it has to do with the anatomy. Now, I took my 3rd grade art skills and I made a little model here of the scapula and the subscapularis muscle. And this is the main reason why you don't see a lot of fascial release work demonstrated on this, because it's tough to get to. This is the scapula from this side, if this was on my right side. So the muscle itself, which originates off the subscapular fossa of the scapula, is the side that's actually against the rib cage. Not the easiest to get to since it's against the rib cage like that. Now on the other side of the scapula, you have your other 3 rotator cuff muscles, and they're much more easily accessible. You have the supraspinatus up high, the infraspinatus and the teres minor down low, so I can actually get my hands on it, and you can palpate that much easier. These 3 muscles all attach to the greater tubercle of the humerus, whereas the subscapularis attaches to the lesser tubercle. So you're looking at the shoulder blade, the scapula from this position. The subscapularis, like I said, is on the inside of that scapula. It's difficult to get to. When it contracts, it internally rotates the shoulder. But you know what? I'm going to show you how we're going to get to it, and we're going to do some release work on it right now. Okay, so let's do that fascia release work on the subscapularis. First off, I got to mention, and I've mentioned this on other fascia release videos that we do about how fascia release work isn't fun, it can be uncomfortable. When we're dealing with the subscapularis, it's at the top of my list as far as being uncomfortable. It is not a fun muscle to do release work on. So I want everyone, if you've never done the subscapularis work, to put a very light pressure on the subscapularis when you first start doing this work today. Don't try to press in too hard. I mean, I do this, release on my subscapularis all the time. Not only is it uncomfortable, but sometimes I experience almost like a burning sensation in there. And I do this work all the time on myself. Of course, I do it on patients, but you got to be very delicate when you first start off doing that. So there's just a little words of wisdom. It's not a fun muscle to work on. Like I said, it's at the top of my list as far as being uncomfortable. So very lightly start off with pressure in there, okay? So how are we going to get to that muscle? I showed you on that little scapula I made how the muscle is actually on the front of the scapula. So in order to palpate it, you actually have to lie. Best way to do it is just lie on your back. Try to let the shoulder, the chest, the back relax. And in this position, and what I would recommend first off, just get a pillow behind your neck. Make it comfortable for yourself. Okay. And just let everything relax. And if you actually take your fingers and kind of dig into your armpit, now you can't feel the entire front of that scapula, but you can get the part of it. And if you press it into the scapula, the subscapularis is in that area. Now, how do you know you're on the subscapularis? Well, if you contract it, you can feel it contract. And how do you get it to contract? Well, the subscapularis internally rotates the shoulder. So have your shoulder internally rotate, bring your knee up, and then press against the knee and do like an isometric contraction. And as you have your fingers in there, you'll feel that subscapularis. All of a sudden, you'll feel a muscle deep in there kind of tighten up. That's the subscapularis. Now, just differentiate it from, what are we dealing with? Well, the larger muscle here, of course, is your lat, and here's your pec. And those, you're not going to mistake in those large muscles for the subscapularis. But when you go in there deep with your fingertips, and you go in right into that armpit, you're on top of the scapular bone, you internally rotate, you press, you're going to feel a small, deep muscle in there contract. That's your subscapularis, okay? So I have my fingers on it. I know I'm on the subscapularis. Now, a couple ways you can work it. Nothing wrong with using the tips of your fingers to get in there. I'm going to get in there, though. I'm going to do some of my soft tissue work, as we often do on these videos, with the Tai Chi ball from OcraMed Health. I'm going to be able to dig in much more efficiently because of the texture on this ball. And once I find it, I'm going to use this ball, and I'm going to get in there. I found that subscapularis, and I'm going to spend about 30 seconds or so just kind of kneading and mashing that subscapularis. Like I said, slowly increase the pressure as you get used to this maneuver, but get in there and just knead and mash it for about 30 seconds. Give it about 10 or 15 second rest, and I'll do that one more time where I'm just going to get in there and just kind of massage that subscapularis muscle. I'll be just kind of wiggling that ball along the front border of that scapula, okay? So, got a lot of blood flow in there now. We just did some self-massage in there. Now what we're going to do is we're going to come up, anytime you think you're off that muscle, just do that little thing where you push against your knee, find that muscle, it'll pop out. Now I'm going to come back to it. I'm going to have my arm forward this way, and I'm going to put some firm pressure with the ball down onto that subscapularis with the arm as rotated forward as I can. And then here's the release that we're going to do with this. I'm going to let the arm completely externally rotate this way. And then from this position, and my elbow's at about 90 degrees, I'm going to extend the arm straight out past my head like this. And then I'm going to come back and come all the way down again. So the release on this, I'm pressing into the subscapularis. I'm fully externally rotating, let that arm come as far back as you can. And then from this position, extend out. Don't let that pressure come off that subscapularis. Extend out and come back. And this is done in a nice, slow, controlled manner. Like I said, I can just demonstrating it. Yeah, it hurts. But just nice and controlled. Firm pressure down on the subscapularis. Externally rotate. Let it relax for a second. Nice and slow. Press past your head and come back. Now once I come back, I will release it as I come back to the starting position, and then I'll put the pressure back down before I begin again. So I do let the pressure off once I've finished the motion and I come back to the start. And what I'll do is I'll run through that release 5 times in a nice, slow, controlled manner, back and forth. I always hit both sides. Even if my right side was my tighter side, I'll come to the left and hit the left. But that's how you release the subscapularis. First 2 30-second sessions of some self-massage, and then perform that fascia release maneuver with either your fingertips or the Tai Chi ball, and just run through it in a nice, slow, controlled manner 5 times. Okay, so as you can see, you might find that technique a little tricky, but it's actually a lot easier than it probably looks. Start working it just like fascia release work that we've done, and I've done videos on, and other parts of the body. You know, it's something that you got to give it some time. You got to be consistent. You know, you may not want to do that every single day, but maybe every other day. Give the tissue time to recover between doing some of the work. But I think if you stay at it, you're going to notice definitely some increased mobility and some increased flexibility of that subscapularis muscle. Okay, great. All right, if you're enjoying these videos, please subscribe to my channel, OcraMed Health on YouTube. If you got questions about exercises or injuries, all you're going to do is leave a comment in the comment section below. I always get back to everyone who writes in. Unless you're one of those people who write in and tell me I look like Bill Nye, the science guy, I don't get it. I mean, he's a handsome son of a gun, but I just don't see the connection. All right? And don't forget, OcraMed Health is here to keep you fit forever.